long does cheek augmentation last? It depends on how you do it. You can do the augmentation with fillers like Juvederm Voluma, and this can last 12 to 18 months, or you can use a cheek implant, and that's permanent. And there are 3 types of cheek augmentation procedures with varying lifespans. Here's a quick guide. How can I augment my cheeks? There are a number of different ways that you can augment your cheeks. This can be with soft tissue fillers, this can be with fat transfer, or with implants. A liquid cheek augmentation with filler is a cosmetic procedure done in the office. We have a very good numbing cream that makes it more comfortable, and then we go over all the different soft tissue filler options. These can range from your Juvederm Voluma or Restylane Lift that can last for 12 to 18 months, or others that can be about 6 to 9 months, depending on what you're looking for. Cheek augmentation using fat transfer is a procedure where we take fat from another part of the body and then it's transferred to their cheeks. This requires either IV sedation or general anesthesia. The issue with this is you're moving the fat without its blood supply, and so some of it will live and some of it doesn't live, and that's what we call the take rate. To account for this, many surgeons will overfill, then you will get to your final result around 6 months. This take rate varies by surgeon, by technique, by each patient. So what you need to do is find someone that does a lot of these and they're able to tell you what their approximate take rate is and give you an idea of what your take rate may be. And keep in mind that you are moving your fat cells, so any weight loss or weight gain will be reflected where it is put. And so if you gain weight over time, you may see a change in your cheeks. For a permanent solution that doesn't change with weight change or the take rate, you might opt for a surgical augmentation using implants. This procedure is the most consistent and be controlled the most precisely. This is usually done under IV or general anesthesia just to be more comfortable, and can be done with a number of other procedures, including a rhinoplasty, chin augmentation, or other facial procedures. Are cheek implants better than fillers? Cheek implants are not necessarily better or worse than fillers. They're just a different option, and one that's completely dependent on the patient. Not all patients are good candidates for cheek implants, and there's pros and cons for every type. It comes down to the individual patient, what they're going for, what their maintenance schedule is like, and what they really want to do long term. Fillers require more maintenance. That is something that you will continue to have to do, but you don't have to have anesthesia, you don't have to have sedation. It's really easy. You come in to the office, do numbing cream, and you're out in 15 minutes. Cheek implants require a more involved procedure than soft tissue filler with more downtime. But it's a more permanent option and it doesn't require maintenance. If you want a one and done, this is the way to go. I like using dermal fillers for people who are looking for a less invasive, subtle enhancement that doesn't require any downtime. A liquid cheek augmentation is a quick procedure that is relatively painless with minimal side effects, such as some mild bruising or swelling, but usually not even that. With proper aftercare, such as icing the area and using either topical or oral arnica before and after the treatment, you can return to work as soon as the same day. Also, if you put on makeup, you can cover up most of that the same day. Fat transfer is a surgical procedure that requires some sedation usually and can have significant swelling and bruising. The downtime can be from a few days up to more than a month if more fat is used. The ideal patient has enough fat cells in other areas such as the thighs, hips, or abdomen that can be harvested with liposuction and then injected into the cheek to give a more youthful contour. I typically recommend surgical cheek augmentation for my patients who want a more permanent solution. The procedure is scarless in that the incision goes inside the mouth between the gums and the cheek, and there are a variety of different implants to choose from to get the best cosmetic outcome for the patient. The most commonly used are the submalar implants. This fills the area below the cheekbone, and this is a really common place to see people lose their volume over time. There are also malar implants. These provide a more prominent cheekbone, as well as a combined shell implant that does both the cheekbone and the submalar area to give volume to both areas. Depending on your anatomy and your goals, we will choose the best implant for you. For fat transfer and cheek implant procedures, I advise my patients to stop smoking for at least 4 weeks before and 4 weeks after surgery, in addition to ceasing alcohol for 2 days before the procedure. Anti-inflammatory medications and aspirin should be avoided for 2 weeks before the procedure. Is cheek augmentation permanent? Cheek augmentation is permanent when using implants. It is mostly permanent when using fat transfer. Our fat in our body does change over time, and so you may see some changes 10, maybe 15 years down the line. With implants, we use medical grade solid silicone implants. These are safe to be left in place for many years and do not need to be changed out. Since they are solid, there is no fluid that can leak, unlike breast implants. They're smooth and your body heals around them. This decreases the risk of bacterial infection or any issues with healing. Also, if there's ever any reason that you need to remove them, they come out easily, unlike Gore-Tex or Medport. How much does cheek augmentation cost? Cheek augmentation can range anywhere from $800 to $7,000 depending on which type of augmentation is being performed. Soft tissue fillers are the least expensive, while cheek implants can be the most. Fat transfer costs depend on how much fat is being harvested and transferred into how many areas. Have questions? I'd sincerely love to hear from you. Call or email anytime. Thanks for watching.